Welcome to Pharmacology lectures. Today we are going to study about sympathomimetic drugs, norepinephrine or epinephrine acts on the receptors, on adrenergic receptors, therefore they are called adrenergic agonist. Now the adrenergic neuron, you have to have a look at here. Now adrenergic neurons release norepinephrine, as a primary neurotransmitter. These neurons are found in the CNS and in the sympathetic nervous system. Now you can see here, this is the adrenal medulla, and here you can find nicotinic receptors, and these are in the now this is pre-synaptically in the neurons or post-synaptically on the neurons. Epinephrine, adrenal medulla, epinephrine is released into the blood and it goes into the effector organs on adrenergic receptor. Here where there are nicotinic receptors in the sympathetic nervous system, they are released norepinephrine in the ganglia and it goes on the effector organs and attached to the adrenergic receptor. These are the two sites of actions for the agonist. Now, neurotransmission at adrenergic neuron. You can have a look. This is the whole mechanism of action. You should understand this. The first step is the neurotransmitter must be synthesized and released. How it is synthesized? Tyrosine and sodium ion, these two enter. Now hydroxylation of tyrosine is this hydroxylation here. It is a rate limiting step. Now next, what happens? Uptake into the storage vesicles. It converts into dopa is the precursor of dopamine, and it converts into dopamine. Now dopamine is uptake in the storage vesicles. Now dopamine enters into a vesicle, and here when it enters into the vesicle, it gets converted into norepinephrine. Norepinephrine is protected from degradation, that's why it is stored in the vesicle, and then it is transported into the vesicle. With this transport in the vesicle, if you inhibit the transport, the system will be blocked. So this is inhibited by reserpine, antihypertensive drug. Now release of neurotransmitter. Third step, one, its synthesis first. Second, uptake in the storage vesicles. Now its release. Influx of calcium ion. This step, influx of the calcium ion, causes the fusion of the vesicle within the cell membrane in the process called exocytosis. Exo means out, cyto. Now this release is blocked by guanethidine. You can have a look here. These are the examples of the drugs which act here. These are the site of actions. Now as norepinephrine is released, it binds to the receptor in the effector cells. After binding, it activates the receptor complex, and then removal of norepinephrine. Released norepinephrine is rapidly taken into the neuron. This released is rapidly taken into the neuron, and reuptake is inhibited by SNRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and cocaine and imipramine. These all inhibit the reuptake of norepinephrine. Here they will work, these drugs. Then sixth is metabolism. Norepinephrine is methylated by COMT. this is maybe carboxymethyltransferase, and it is oxidized by MAO. Now when it see catechol O methyltransferase, okay, this enzyme and MAO, these two, they metabolize the norepinephrine, and when it is metabolized it converts into inactive metabolites and it is eliminated in the urine. This is the whole cycle of norepinephrine, adrenergic system, sympathomimetic system. We will, if you understand this, it will be easy to understand the mechanism of actions of the drugs we are going to study, direct inhibiting or indirect inhibiting.